So Dr. Day, you run one of these clinics, these medical clinics that have existed in BC for more than 2 decades. Can you tell me what types of services these private BC clinics offer?
Well, we provide a whole spectrum. Each year, the private clinics in BC treat 89,000 patients, and many of those clinics are now under threat. The types of procedures we do a lot of orthopedic procedures. We treat a lot of injured workers under the workers' compensation system. They're exempt from the rules. But we do orthopedics, general surgery, some neurosurgery, spine surgery, and then a lot of diagnostic procedures like colonoscopies for cancer patients, biopsies of cancers, and so on. So it's a wide spectrum of surgeries, urology, and so on.
You mentioned something that's interesting to me about that case, which is the exemption for workers' compensation procedures. So the thing that struck me about this case is that if a person is injured at work, the workers' compensation regime allows them to be treated outside the government monopoly system. They can be treated in these clinics, in these non-government clinics. What can you tell me about that and about the logic of allowing that, but not allowing a person with an identical injury who was injured at home from seeking care in those clinics?
Well, it's historically that the workers' compensation board, which operates, we had a witness from the board, a director who's actually an opposing witness, but he admitted that the workers' compensation operates as a private insurance system. It's completely funded by employers. It has no government funding, and it operates in a private insurance scheme. And the rationale is when people are injured and they're having to look after them and pay their benefits, it's much more efficient and less expensive for them to get them treated quickly, and also long-term disability is less. But there are other exempt groups like Canadian Armed Forces, veterans, federal employees, and including judges are exempt, and prisoners are exempt. So it makes no sense. And the other group, of course, is cross-border. So every time I do surgery, I'm operating these days on several Albertan, sometimes Manitoba, Ontario patients. Once you cross the provincial border, you're exempt. You're not brought under those rules.
This is a part of the debate around the government monopoly healthcare system that I always find so kind of hypocritical by opponents of allowing innovation, because we already have private insurance in Canada for all kinds of things in our healthcare system, dental care, vision care, physiotherapy, for medication. Why is that type of medical care treated differently by our government or by the government in BC than, say, a knee replacement?
Well, there's no logic in it. Literally, the diagnosis of pneumonia, for example, or an infection is covered under provincial Medicares, but the treatment, i.e. the drugs and the antibiotics, are not covered, and that makes no sense. The other jurisdictions around the world, and I think it's important to stress, we are unique in the world in making it unlawful to get insurance for healthcare when the government won't supply it. But healthcare systems around the world are of a similar nature. European countries, New Zealand, they cover prescription drugs. We don't even cover an ambulance. The one time you can't, to me, it's nonsense that you need an ambulance with a heart attack or a broken leg, and that's private.
Canada's not just alone in prohibiting this. We also stand out in terms of wait times, the wait time for certain surgical procedures among our OECD allies, and we in fact have some of the worst wait times. I want to talk about this more in the next segment, but just briefly, what can you tell us about where we stand on wait times among our allies? We've got about 20 seconds.
Yeah, so even pre-COVID, and this was evidence in our trial, over 35,000 British Columbians were waiting beyond the maximum time that the government said would be harmful for them to wait.